Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedics, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Like the man says, my name is Dr. Bernie Portner, here today and every Saturday at this time to take your calls and try to answer your questions regarding arm, leg, neck, or back pain. Today is October 10th. And we're live at 7:06. The first hour of the show from 6 to 7 was recorded. So now if you do have questions for me, you can call in to 521-8383. That's 521-8383. Neighbor Island listeners can call toll-free as well at 1-888-565-8383. So if you have a question regarding arm, leg, neck, or back problems, questions related to sports injuries, car accident injuries, work-related injuries, any sort of orthopedic questions, health or fitness questions, I'll be happy to give it a try to answer as best I can. Again, 521-8383. Today we're going to take questions as usual, but perhaps have a slightly different approach for a change. I usually talk about injuries and various treatments and various tests, and that's the way it's been going since 1989, believe it or not. That's how long I've been doing the show. I thought today we could spend a little bit of time on not only talking about how to treat and diagnose and manage various orthopedic injuries and conditions, but perhaps also how to avoid these types of problems. And, the old expression, an ounce of prevention is worth a pound of cure, that definitely applies to orthopedics, and to medicine generally, I might add. But in orthopedics, many of the injuries that we see are avoidable, if not absolutely self-inflicted. And let's explain that a little bit. Sports injuries. There are two types of sports injuries. That is, those types of orthopedic problems that come on as a result of participating in sport or exercise or health or fitness activities. The first type is the overuse injury, when people do too much too soon. And the second type are ballistic type of injuries, like when someone gets tackled in football and the knee gets bent sideways and you tear a ligament or a meniscus inside your knee. So sports injuries, two types: sudden ballistic violent injuries, and overuse, kind of in pernicious, kind of gradually come on type of injuries. This overuse injury is avoidable. How? Well, it's most common in people who just are about to begin a sport or begin an exercise routine. They've been sedentary, they've been inactive, they've been outside of their usual sports routine for months or years, and they decide enough is enough and I'm going to go out and I'm going to play. And instead of playing initially just a little bit and then gradually build it up, they ignore the fact that they haven't been doing this activity, whether it's running or playing soccer or playing basketball or even golf or tennis. They've been out of it for a while, or they never played it, and they suddenly start to play 3, 4, 5 times a week to exhaustion. And before you know it, there's a overuse injury. One of their tissues, a muscle, a tendon, a ligament, a joint, doesn't respond well to the sudden increase in activity and breaks down with time, and you get an overuse injury. And the way to avoid it, well, on this show I often say you got to get out there and exercise. You got to get out there and start walking. You got to get out there and be active and physically exert yourself. When you hear that advice, definitely take it, but take it easy. In other words, If you haven't been walking much, you've just been sitting around and you've been listening to me or others or your doctor, and they say, listen, you got to start to get active. It means to start easy. Don't start off with a bang. And in that way, by being reasonable, by being rational, by being moderate, you can avoid those injuries that are very common in the initial few weeks and the initial few months of beginning an activity. Start slowly, start short distance, start a little bit of a time at a time when you can play for a half hour and then stop and rest and skip a day and see how you feel and then play for 40 minutes 2 days later and on and on. So that's one bit of advice I have. Start your activity gradually. It's the beginning of new sports-related or physical-related activities that is the window of the time when it's most common to be injured. So that's a little bit of advice. Yes, begin an exercise routine. Yes, take up a new sport, but do so with caution, knowing that it's in those first few weeks and couple of months of a new sport, new activity, where you're most susceptible to have injury. And then, of course, you have to stop, and you're no better off. People, sometimes I've heard people say, I was feeling okay. I had no injuries, and then I decided to start a sport, and I started taking, tennis lessons, for example, and now I have a tennis elbow, or now my back hurts. I would have been better off if I hadn't started at all. Well, that's not exactly true, but I see how people feel, and the way to avoid that is to use common sense. That's common sense. It turns out isn't that common anymore. But that's my advice. Start out slowly and build up gradually, and you can avoid a lot of overuse injuries. 521-8383. It's Dr. Bernie Portner on the Moving Body. Welcome and good morning. If you're having any problems with your arms, legs, neck, or back, it's a good time to call. The lines are open later in the show. They often are full up, and people complain that they can't get through. So don't hesitate. If you have a question for me regarding the limbs or spine or any health or fitness question, just give me a call, 521-8383. I know there are those out there that are listening and have a problem but are too shy to call. And that's fine. Most of the people that listen to the show don't call, obviously. But for those of you that are suffering with an injury and don't want to talk to me on the radio, because after all, that makes it quite public, you can call the office, 596-7300. That's 596-7300. And make an appointment and see me or one of my associates at your convenience in private and so on. So the number at the office, 596-7300. But for those of you who are not too shy and have a question for me, just call here. We have another 45 minutes, 521-8383. Dave, go ahead. You're on the air, and thanks for calling.
Hi, Doctor. Enjoy your show. Thank you for doing it.
Thanks, and thanks for calling. What's up?
Well, I've got a host of different things, but I kind of like to concentrate on my thumb, my right thumb. I don't remember exactly when I did it, but I've re-injured it quite a few times, and I've jammed, basically.
And when was the last time? Was it days ago or weeks ago or months ago?
I would say it was months ago that I actually jammed it, but it's bothered me it's kind of bothered me a little bit now, and I feel a sensation kind of past my wrist, about maybe 3 inches even past my wrist as well.
You mean up towards the thumb?
Up towards my elbow.
Oh, up towards your elbow.
From
So,
yeah, from my knuckle on my thumb. And the second knuckle, I guess, which is under that. There's also kind of a lump there, sort of like a deposit in comparison to the other side.
And when you jammed it a few months ago, the knee was perfectly normal at that time?
No, I think done a lot of fishing for years too, and cranking on fairly large fishing reels. You know that.
Yeah.
That's been I don't know, aggravating, I would say, for quite some time.
Right. And if you let's do a little examination over the phone. I try to avoid this, but sometimes I'm so curious I can't help myself. Which hand is this? Your right hand?
It's my right.
So put out your right hand like you're going to shake somebody's hand, so that the thumb is sort of pointing up at the ceiling.
Okay.
And then grab your thumb with your other left hand and try now to point your thumb directly upwards at the ceiling, but with your left hand resist that effort so that you're pushing against your left hand with your thumb as it tries to point to the ceiling. You follow me?
Gotcha. Yeah, pretty good strength still there.
And does that hurt at all?
Not really.
I see. And if you just passively, with your left hand, grab your thumb and bend the very last knuckle, the very last joint, just by your fingernail, does that hurt?
Not especially.
And if you bend the next knuckle, the one closer to the wrist, and bend that all the way down with your left hand, does that hurt?
That starts, yeah.
That starts to hurt. And then if you grab the base of your thumb bone, where all that muscle meat is, and try to bend it towards the palm, does that hurt?
I'm sorry, towards
your palm. Bend it down.
Yeah, that's where it is.
So, without really examining myself, this is exercise in futility, but just from what we've done, if true, when you jammed your thumb some time ago, you may have injured the joint itself. It's possible to injure the ligament or tendon also. But
I'm sorry, doctor. I should have mentioned I did have an X-ray, and the doctor said, "Oh, it looks okay."
Yeah, okay. So we know it's not a fracture, and we know you don't have long-term degenerative arthritis, because both of those things would have shown up. But that just eliminates two possibilities. There's still a dozen left. Anyway, it sounds like you have what's called, this is just a radio guess. Let's call this a radio guess.
Okay.
Traumatic capsulitis of your, of one or two of the joints of your thumb that attaches it to the hand. And that can be treated quite effectively, if true, with a combination of mobilization, a form of physical therapy, combined with some exercising, and if unsuccessful, a tiny injection into the joint. So if that's what you have, the prognosis is quite reasonable. The outlook is not too terrible.
Okay.
All right.
I noticed, when doing like tedious small things that take a little strength, that's where it really kind of having an effect on it.
I think if you see your doctor or see an orthopedist, they can take care of this for you over on Maui. If not, if you ever come into town, I'll have a look at it for you.
Okay. And the injection you're talking about, would that be cortisone?
Yeah, it would be a small drop of cortisone-type medicine.
Okay.
Yeah.
Appreciate you and your show.
Okay, thanks for calling, Dave. Have a good day.
Aloha.
Aloha. 521-8383. Nancy, go ahead on Kauai. You're on the air, and thanks for calling.
Yes, hi, Dr. Portner. I was listening to your show last week, and you got a call from a woman who was having problems in her neck that also hurt her down to her low back. And you mentioned something, is it called the dura?
Yes.
Could you tell me explain more about that?
Well, the dura is a membrane. It's a membrane, it's a sheet of tissue that encases the brain up in your skull. It encases your spinal cord all the way down to the lower back. And that case is called the dura. And inside the dura is fluid and in that fluid floats your spinal cord and brain, and it's one continuous sac. And sometimes you'll irritate the dura, and it'll refer pain into areas far away. And I don't remember exactly what was said, but that's what the dura is. And when you irritate it, it can cause pain there and elsewhere. So typically, dural irritation in the lower back may refer pain down the leg, called sciatica. Dural irritation in the neck may refer pain down the arm. It may cause headache because it goes up as well. So that's all there is to it, the dura. And, we have a term called the epidural, and that's an injection where medication is injected outside of the dura, around it, so that anything outside the dura that's irritating it can be treated with an epidural injection, sometimes quite successfully. Does that answer your question?
Yes, it does. Thank you.
Okay, and do you have internet access? Do you use a computer?
I don't, no.
If you have a friend that does, it's a lot of fun. You could type in Dura and hit search, and you can get pictures of it and learn all about it.
Oh, okay.
All right, Nancy. Thanks
you.
for the call.
Bye.
Bye-bye. So, 521-8383, if you're having any questions regarding arm, leg, neck, or back pain, give me a call, and I'd be happy to try my best to answer your questions. I started out the show saying we would try a new angle to this orthopedic medicine business by talking about avoiding injuries and avoiding painful conditions. And it did not yet generate that much interest in terms of numbers of phone calls. And I don't know if you guys are interested in that, but it seems terribly important. In medicine, especially right now, by the way, this didn't occur to me until I just said it, but right now we're talking about health care reform and uninsured people and insurance and universal coverage and whether people have an inherent right, like in Europe, everyone feels they have an absolute right to medical care, whereas some people here feel that actually it's an earned privilege and it's not a natural born right. But I have a story to tell that when I was in training many years ago, I spent some of my time at a VA hospital in training, and this was over in Michigan. And it occurred to me, I was on this service with attending physician, resident physicians, an intern, and medical students. And I noticed this, by the way, when I was a medical student. I noticed the same thing when I was an intern, and I noticed the same thing when I was a resident. But at one time, I was in charge, or at least I had responsibility over about 18 or 20 patients that were hospitalized. They were plenty sick. They couldn't not be in the hospital very easily. And when I took, and I would spend hours and hours, day after day, 8 days a week, working on these patients and trying to figure out what was wrong and trying to manage their problem and trying to get them better so that they could be discharged. And at one particular point, I sat down and I looked at my list of patients, and every single one of them, pay attention right now, every single one of them was there because of poor health habits. They had conditions that were self-inflicted. Let me explain. Several of them were IV drug users, and they had an infection related to the IV, a dirty needle. And they had a very severe infection called endocarditis. When your blood gets infected from a dirty needle, you're injecting heroin, and the infection goes to your heart, and it infects the inside lining of your heart, including your valves, and you get these infected growths on the inside of your heart, and it often kills you. Endocarditis. They didn't need to be there if they weren't drug users. I had alcoholics there with liver failure and bleeding and esophageal cancer, and they were dying. There wasn't much to be done about them. And that was strictly voluntary, drink too much, be an alcoholic, and get this. Otherwise, if you don't, you're not in the hospital. Of course, half of my patients had very serious medical conditions related to smoking. And they had either a heart attack that they wouldn't have had if they didn't smoke. They had peripheral vascular disease where they had to have one of their limbs cut off because the blood vessels got so narrowed with plaque that it no longer had enough blood to support the tissues and became gangrene. And that was strictly related to smoking. If they hadn't smoked, they wouldn't have gotten this. And then, of course, there was a throat cancer patient, a tongue cancer patient, a lung cancer. The first one was tongue. Yes, tongue cancer. A lung cancer patient, all related to smoking. And then, more than anything, was the COPD, chronic obstructive pulmonary disease. That's emphysema and chronic bronchitis, all strictly related to smoking. If they hadn't smoked, they wouldn't be there. So smoking, alcohol, drugs. And nowadays it would be easy to add obesity, causing a lot of serious health conditions, and inactivity, where people are just sedentary, and that's just as bad. So all those habits led to my having to go to work every day and try to help these 18, 20 people who brought it upon themselves. And we're talking about, initially, we're talking about how to avoid orthopedic injuries, start off slowly. That's when you start a new sport or activity, that's good advice. But in general, for general health, and if you want to control healthcare costs, what you got to do is prevent the need for health care, or limit, minimize, diminish, decrease the need for health care. And we're mostly in the hospital, and we're mostly taking drugs, and we're mostly seeing doctors for conditions that are easily avoided just if we don't take up bad habits of drugs, alcohol, smoking, overeating, and inactivity. Make a list. Anyway, I thought I'd get that off my chest. 521-8383. Give me a call if you have any questions regarding arm, leg, neck, or back problems. We're having an unusually slow number of callers. I guess not too many people are that intrigued by my new approach to avoiding injuries and avoiding the need for health care. But you're welcome to call me about back pain. A lot of people have back pain. They can't sit, and they don't really realize that that's possibly a serious disc problem, and they are very uncomfortable when they sit through a movie. If they're students, they're very uncomfortable in class, and they're always squirming, and they can't pay attention. I see this all the time. And it can be treated, and it can be taken care of. So I encourage you all to give me a call if you're suffering with back pain, and more importantly, if you don't want to give me a call, is know this. Most conditions that result in lower back pain or neck pain, for that matter, are diagnosable and treatable. Sometimes curable, sometimes not curable, but treatable, meaning you can diminish the pain and discomfort, and you can improve your function, your quality of life. After all, pain is bad enough, but a part of the problem is what these various injuries keep you from doing. So a lot of times, back pain, okay, it's back pain. You lay down, it doesn't feel so bad. But then you're lying down. You're not going to the family on a picnic. You're not joining your friends at the park. You're not going to the football game. You're not going and playing anywhere. You're denying yourself certain activities because you know it'll bother your complaints. We're going to break for the news, but don't go away. And right after the news, we'll take our next callers. You can call right now during the news, 521-8383. Don't go away. I'll be right back.
You're listening to Dr. Bernie Portner on The Moving Body. Hope you're enjoying the show. If you have a problem with your arm, leg, neck, or back and are somewhat afraid or too shy to call, just call my office, 596-7300, and make an appointment to see one of us live and in person. Otherwise, call here at 521-8383, and we'll try to answer your questions. Thanks for listening, and let's get on with the show.
When your doctor says that you need an MRI, are you filled with uncertainty? Let the caring professional staff at Envision Imaging put your fears to rest. Envision Imaging uses the most advanced 3T MRI imaging technology available in Hawaii. Get ready for your MRI in a private dressing room. As your MRI takes place, you'll be relaxing in a quiet, serene, spa-like setting. You can even watch TV while you are getting your MRI with their advanced audio-visual goggles. Free transportation services are available. Envision Imaging is open 7 days a week with evening and weekend appointments too. There's plenty of validated parking. All insurance is accepted. For the highest quality MRIs available in Hawaii in a quiet, relaxing atmosphere, call Envision Imaging at 593-8080. That's 593-8080, or visit them online at www.envisionhawaii.com.
Okay, here we are back live. Alice, go ahead. You're on the air, and thanks for calling.
You've helped me a lot. You know, I originally had water in my knee. I don't have that problem anymore. But there's tightness, you know, from the thigh down to the calf area, sometimes even to my toes, tightness. And then sometimes early in the morning when I'm standing, I have discomfort in my lower back where I have to sit down.
And the tightness from your thigh to your toes, does that come on only with standing also?
Yes.
And
actually, there's an underlying thing that's, I know that it's not normal yet. You know, that there's some kind of problem.
But how is your knee when you bend your knee open?
Oh, there's no problem now. I have.
So, because the knee can also cause tightness and pain feelings in the thigh and lower down. But when somebody has back pain and thigh pain and pain down to the toes with standing, and Alice, is this relieved if you sit down?
Yes.
Yeah. And how old are you, Alice?
I'm in my 70s.
Yes. The most common condition, I'm just guessing over the phone, remember that, but the most common condition of what you're describing, that is back pain and thigh pain or tightness and calf pain or tightness and all the way down to the toes, with standing or walking, and relieved with sitting down, is what's called spinal stenosis. It's a condition of the lower back where the canal where the nerves are all stored becomes narrowed for a variety of reasons. But these reasons are usually those that take several decades of lifetime to develop. So that's why we see it in people in their 50s, 60s, 70s, and beyond. It's rarely seen in people less than 50. And that's my first guess, that all these symptoms in your thigh and down to your toes are likely coming from your back. I don't know that for sure over the phone. It's just my first guess after hearing what you have to say. So maybe you need to come back in and we can look at your back.
And could you explain what is PAD?
PAD. I don't know.
It has to do with something. Sometimes they tell you over the phone about maybe it could be circulation.
Maybe peripheral arterial disease?
Yes.
That's probably not what you have. If you just stand still but don't walk, like you're standing in line at the grocery store or something, does it start to bother you?
No.
Do you smoke cigarettes?
No, I've never been a smoker.
It's very unusual. Are you diabetic?
Yes.
Type 2.
So peripheral artery disease, PAD, that can cause pain in the leg with walking, relieved not only with sitting, but just by standing still and not walking. It's rarely seen in non-smokers, but if you're diabetic, that sets you up for possibly that's what you have. And it's pretty easy to figure it out. Is this from your back, a spinal stenosis, or is this from your blood vessels?
Right now, while standing, the most place that I feel the tightness is in my calf.
Yeah. That could be either also. So the thing to figure out is, if it's not your knee, it doesn't seem to be, is it your spine or is it your blood vessels? And it would be rare to see somebody with a blood vessel problem that doesn't smoke, but not impossible. But it needs to be checked out, and we could do that, or you could see your regular doctor for that.
I see. Well, thank you very much.
Okay, Alice. I hope this gets better soon. Don't ignore it. That's the main advice. Get to the bottom of it. Okay.
And you would suggest that I exercise?
Well, yes, but I'm not making specific suggestions right away until I see you. But yes, as a general rule, of course, exercise is something you wanna do. Okay?
All right. Thank you very much.
All right, Alice. Let's see. Leilani in Waikiki. Leilani, go ahead. You're on the air, and thanks for calling.
Good morning, Dr. Portner.
Good
I have
morning.
two things that try to be very quick. I thought they'd be useful to other people.
Okay.
I did have a compression in lumbar 4 and 5 some years ago. I was on ibuprofen for 3 months, never had a diagnosis, used the local van service, which I appreciate very much. And so I was just wondering if I didn't have any, had a kyphoplasty at the time, is there anything updated for a late taking care of a compression between 4 and 5 that was never taken care of?
Is it still painful?
Oh, no.
No, then there's not much to be done.
Yeah, the other quick question is, somehow, I really don't know how, I got a contracture, and this basically...
Where?
Behind my knees. I no pain, just tightness of the skin, and had some kind of vague therapy, walking up and down the hallway of the therapy place with my walker. Didn't use any of their equipment, and I just wondered what the cause of the contracture is.
Well, contractures, for those who don't know, just are conditions that cause a limitation of motion of a joint. And in this case, it sounds like your contracture limits your ability to straighten out your knee completely.
That's true.
And it can be either a tightening of the skin, a tightening of the tendons behind the knee, a tightening of the ligaments behind the knee, a tightening of the joint capsule behind the knee. It can be any of those, and it has to be diagnosed more precisely. Usually, it can be treated, but just walking up and down is not going to do it. You have to have it worked on by a therapist who's willing to stretch it.
Dr. Portner, do you know what the initial cause might be, though?
I don't know.
Yeah.
You tell me. I don't know.
Right.
Yeah.
Okay, well, thank you very much.
Okay, take care of that, Leilani, though, because it usually is somewhat treatable.
Yes, thank you very much.
Okay, I hope that helped you. You're welcome. 521-8383. Leon, go ahead. You're on the air in Kaimuki.
Yeah, okay. Hi, Dr. Portner. Thank you for the program.
You're welcome.
About in 1980, I lost a tendon in my right knee playing softball, and I was diagnosed by an orthopedic, and then I was given a brace to wear.
What tendon, do you remember?
Well, he mentioned either the anterior or the posterior.
You sure it was a tendon and not a ligament?
Well,
it might have been a ligament.
Yeah, okay, but so now I'm going back to softball, and then I kind of injured it again, and then since I've been on Celebrex.
Yeah, now all these years you weren't playing, and then suddenly you started to play again?
Yes.
And you wore a brace when you were playing?
I wore a brace, yeah.
And it was the same brace this guy gave you in 1980?
No, I have a different brace now.
Does it look like it does the same thing, or is it less of a brace?
It's a less of a brace.
Yeah. So it's kind of hard because the history is sketchy. I don't think you lost a tendon. I think you may have torn a ligament, and the brace he gave you was to sort of substitute the function of the ligament by putting this brace on that helps your knee not move excessively. You see, ligaments hold one bone to the next, and it holds it kind of tightly. And if you lose one, usually joints have many ligaments, and if you lose one of the major ones, then you have excessive looseness of the joint. And with each movement, the joint is allowed to slip and slide in abnormal ways, and this can lead to injury and accelerated wearing out of the joint itself. And then you went out and played probably without a proper brace, and because that ligament, of course, is still absent, still torn, it probably wiggled and jiggled and injured your knee because of the instability. I'm just guessing, you understand, over the phone.
That's pretty much what happened, yeah.
Yeah, I think that's what happened. Now, the question is, what are you going to do about it? Well, you rest it, and you can take your Celebrex, and maybe, without examining you, I don't know what else can be done. It might be too late to repair your knee, what, and maybe you need to go to an activity that doesn't stress your knee so much, maybe something in the water, maybe swimming. But it might be that you can't do this sport.
Okay.
I don't know. That's what your knee seems to be telling you. Because let's say you rest it and you go to the doctor and they do some therapy and they give you a shot, I don't know, and you get better, and then you go back to your sport and it happens all over again.
Yeah.
So
You
that's
see what I've developed some swelling now. So,
yeah, you got it. Well, if it's swollen, it's likely it's inflamed. It's likely it's an arthritic condition right now. But don't despair. I mean, you have to get over this episode, whatever it is. That's going to take a diagnosis and proper treatment. And then you have to address the future. How can I rehabilitate this knee and make it stronger and less susceptible to re-injury? And then what activities can I safely begin with and build up from?
I see.
Okay, so it's kind of a several stage process. And the first stage you're in right now is to get over this episode right now. So do what you're doing and have it properly looked at.
Okay. One more final question. Does your office take TRICARE?
Yeah, we do.
Okay,
I
thanks.
think you need a referral from your doctor in the military, but then we can see you. We see a lot of military people.
Okay, thank you very much.
All right, thanks. Good luck
Bye.
with this, Leon. Mary in Kaimuki. Mary, go ahead. You're on the air, and thanks for calling.
Good morning. I'm calling regarding MCL.
Yeah.
I had a strained right knee.
Yeah.
And I'm under physical therapy right now, and everything's improving. At what point may I go back to walking or on level area or on hillside walk?
Well, you're getting physical therapy, yeah?
Yes.
Well, your physical therapist is very well trained to help guide you back to resumption of normal activity. So he or she, that is your physical therapist, would be best suited to answer that question.
Okay, I asked and I was told that even if I have some pain, as long as it's just slight pain, it's okay. If it begins to get worse, then I'm to stop and to put a cold ice on it.
That sounds pretty reasonable.
Oh,
Mary.
all right.
That sounds reasonable. How long has this been going on? I'm just curious.
Maybe I had it for about a month, and then I went to physical therapy for about 2 weeks, and I see total improvement.
Oh, perfect. So, yeah, just follow the directions of your therapist and of your body. Your body will tell you when you're doing something you shouldn't be.
Yes, okay. Now, can you also please tell me, initially, my doctor had put me on a knee sleeve. What does that do?
A knee sleeve, if it doesn't have any metallic reinforcements, it's just a compressive device, like an ACE bandage, like an elastic bandage, and it just compresses. It doesn't do much, frankly. It helps to prevent or minimize swelling, and it keeps the knee warm. And but otherwise, and it maybe gives the patient a little sense of security, but maybe false security.
Okay.
But it's not that useful for MCL. If you brace it, we usually have to put in metal hinged braces to prevent the side-to-side movement.
Yes, thank you very much for the information.
Okay, and thank you for the call, Mary. Bye-bye. Ginger, go ahead. You're on there, and thanks for calling.
Oh, hi. I'm in my 60s now, but I have been all my life, even when I was in grammar school, standing in the glee club, and I didn't realize it until I was out of high school, really, but I don't have the same ability to stand for lengths of time that most people do, and I've always been very active. I took sports all through school, and I swam, and I take ballet, and I work out, and all this. But my back is straight, and I have decent posture as far as I know. And is it something some people are just born with, where they just can't stand as long as other people can?
I don't know. It's an interesting question that you raise. When you say you get tired when standing, that you can't stand as long as other people, what specifically prevents you? What specifically starts to bother you? What do you feel when you start to stand?
My legs ache.
And what part of your legs? Is it your calf or your thighs or your knees or your ankles?
From my knees up through my lower back. And I can sit for a while and then I get up. But like if I go into a long cooking session or something.
Yeah. And you had this since you were little.
Under my feet, you know, and everything. So
yeah.
it's just irritating that I don't have a tolerance that other people do.
Right. Well, there is a congenital condition. I'm just guessing, right? Because this is over the phone and it's for fun here. But the most common cause of pain in the legs or tiredness of the legs with standing, relieved with sitting, we talked about this earlier in the show, is called spinal stenosis. It's usually a degenerative acquired condition seen only in people beyond the age of, say, 50 or more. And it's very, very common. But now you're telling me you have this not only now, but you had it when you were a teenager.
Yeah, well, even when I was in fourth grade.
Even fourth grade. And I'm wondering
all
if,
the way up.
and I'm wondering if, you know, it could be something unrelated to the spine. But if it is related to the spine, perhaps you have a congenital stenosis of your spine, meaning you were born with an inherently small caliber tube where the nerves in your back are housed. Have you ever had an MRI or CAT scan of your lower back?
I'm trying to think. No, you've done one of my neck, but not my lower back.
Oh, you're a patient of mine. So,
for 25 years or so, for one thing or another.
Yeah, I don't remember you or this particular problem.
I don't know why. I only have a million patients.
No, I mean, this is did you ever ask me about it in person?
No, I never.
Oh, I see.
Never
because
did.
this would stand out because it's so unusual.
I never did ask.
Yeah. And let me ask you this. Now, let's forget about your fourth grade experience. Right now, you're still active and you're still physically fit and you're still happy with your activities.
Yeah.
But if you have a long line to stand in.
Yeah. Or if I'm cooking for a couple hours or something like that. Or if I'm just running around the house doing stuff. It doesn't have to be just standing, but standing is more tiring.
But is it really affecting the quality of your life? Is it interrupting your everyday activities? You have to sit down often and interrupt what you're doing?
In terms of chores, yeah. You know,
And what about sports activities?
No.
What do you do for sports?
I swim and do weights and walk.
And when you go for a walk, do you find that you have to stop short and rest and sit down?
No, but I get tireder than my friends of equal age do.
And when you say tired, you mean this discomfort in your calves?
It's not in my calves.
It's in your...
No, it's just by the end of, let's say, a walk around Diamond Head or something, my legs are more tired than my...
Your whole legs? Thighs?
From my knee up through my middle back.
I see, so it's your thighs and your...
Not my thighs, but more the back of my legs.
Mm-hmm. Well, that's your thigh.
Oh.
The back of your thigh. Anyway, let's research this. I would say that you should probably figure out what the problem is and see what the options are to get rid of it.
Oh, really? You think I might be able to?
Yes.
Oh.
Yeah.
Okay, well, thanks very much.
Okay, Ginger, thanks for the call and good luck with that.
Aloha.
Bye-bye. Let's see, 521-8383, Bill on Kauai. Go ahead, Bill. Thanks for calling. You're on the air.
Good morning.
Good morning.
This must be spinal stenosis morning.
It could be. I think every morning is a spinal stenosis. It's so common.
I am 81 years old.
Yes.
And I've been diagnosed with spinal stenosis, and it's getting progressively worse. And I've been doing exercises that I was given, and I did a short physical therapy session, but it doesn't seem to help. I just wondered how can an exercise program relieve the spinal stenosis?
There's certain exercises that can help, but it's not going to cure the thing. There are certain physical therapeutics, not exercise, but like traction, that sometimes is useful. And how bad is it? How far can you walk before you have to sit down? Is it right away, or can you walk a couple blocks?
100 feet. 200 maybe.
And then you have to sit?
Or lean against something or sit, yes.
And have you tried any injections so far?
No injection, no.
You're in good health otherwise?
Well, I'm diabetic.
Otherwise, you're in good health?
Yes.
There are various procedures available now. So if you try traction and you try an injection and you try various other things and they don't help, there are some more invasive type treatments that can fix this. They're doing a new procedure now where they just put a block of metal between your spinous processes, the bumps on your back, those little bony bumps on your back. The surgeon goes in there and puts a little block between two of those processes, and that allows people to stand up longer in some cases. And then more radically, you can have what's called a laminectomy, where the spinal stenosis is made big. The narrowing of your spinal canal is enlarged.
Well, how?
And that allows the nerves to breathe when you're standing, and it can basically cure the problem.
What's the danger of that?
Well, it's pretty safe, actually. It's done in elderly people because it's the elderly that get this. And just like any surgery, of course, there are inherent risks, but for the most part, it's quite safe and almost predictably effective. So it's something that you need to talk to your surgeon. You know, like I said, I'm not recommending surgery right off the bat. You might try traction. You might try an epidural corticosteroid injection. But if those fail, there are surgical solutions. And people who listen to this show know that I'm not a big advocate for surgery right away. But there are some conditions, and spinal stenosis is one of them, where I know out of experience that when other things fail, surgery is a very good option.
Okay, that's what I want to know. Cause that was what I was told, that surgery was a possibility.
Yes, and remember there are newer procedures now that are called minimally invasive, where, like I say, you don't have to do much. You just put a little block of steel between the two processes. That's an outpatient procedure right through the skin. But other than that, you would need a bigger time operation. But I think it's premature to talk surgery, except to say if it comes to it, it's can be very safe and very, very effective.
Okay.
All right, Bill. Good luck with this. Thanks for calling.
Thank you very much.
All right. You're welcome. 521-8383. We have time maybe for another quick call. I don't know. We have another few minutes. So if you have a quick question for me, 521-8383. Otherwise, if you're suffering with an arm, leg, neck, or back problem, whether it's due to a sports injury or work-related injury or something, a car accident or something that occurred at home, and you want to get it diagnosed and taken care of, call the office, 596-7300, and we'll see what we can do. A couple quick announcements in these last closing minutes. One, I'd like to welcome Dr. Yolanda Hawkins, a new doctor that joined the practice as a fellow. She's doing very well. I don't know if she's listening, but good morning, Dr. Hawkins, if you are. And another new doctor that started a couple months ago, Dr. Zephyrkhan, Kyber Zephyrkhan, a very great, nice young gentleman who has joined the practice and adds a lot to it, very skilled already. We want to welcome both of them. And another quick announcement. We've recently begun using an ultrasound diagnostic machine. We've been using ultrasound for a long, long time to treat patients, but now we have this new ultrasound machine that allows us to see muscles and tendons and ligaments and joints very clearly and helps us a great deal in diagnosing problems. Let's take our last call. Melo, go ahead. You're on the air.
Yes, Dr. Portner, I just want to thank you. You took care of me, I would say, about 18 years ago.
18 years ago.
I had problems with my thumbs, and you injected them, and I never had problems with them ever again.
Wow.
And that was back then when you had Goose working for you?
Oh, yeah, I remember Goose. She was a big baseball fan.
Yeah.
Yeah.
I had a good experience in your office. I just want to let you know, and I also had my nephew see you, and you took care of him also.
Oh, great. Well, thanks for the call. 18 years ago, man, you're starting to make me feel old already.
Well, I'm coming right behind you.
All right. Well, thanks for taking the trouble. I appreciate that.
Thank you, doctor.
All righty. You're welcome. So we're going to close up the show in about 30 seconds. Probably no more time for callers. Remember how I started the show, though? Avoiding injuries, avoiding diseases, avoiding conditions. If you're going to start an exercise